Hello friends, welcome to Being Parents. Today we will talk about jaundice in newborns. Jaundice means yellowing of a person's eyes and skin. In most of the cases of jaundice in the newborn, severity is very low and no treatment is required. But severe cases can lead to blindness, deafness, permanent brain damage or disability. Here we will discuss the danger signs associated with jaundice in newborns. What does jaundice mean? Jaundice means yellowing of a person's eyes and skin. This yellow color is due to the presence of a substance called bilirubin in the body. Why do newborns have jaundice? Jaundice is caused by the presence of a substance called bilirubin in the body. Bilirubin is formed by the breakdown of red blood cells. Normally, it is not visible in the body because the liver metabolizes it and excretes it in the intestine. It is then removed from the body through feces. Red blood cells are high in newborns at birth. These red blood cells naturally break down to a certain level in the first few days of life. At this time, the formation of bilirubin exceeds the ability of the baby's liver to take it out. Bilirubin accumulates during this process, causing jaundice to appear. Bilirubin has antioxidant properties which is helpful for the child. But excessive amounts of bilirubin in the blood can cause severe brain damage. In most cases, the level of bilirubin pigments remains within an acceptable range. This is called common jaundice or physiological jaundice. Physiological jaundice requires no treatment, it will disappear of its own after the first 2 weeks of life. What is the difference between direct and indirect bilirubin? Bilirubin pigments produce two different types of jaundice. Indirect bilirubin is a non-dissolving form in water. Most cases of jaundice, including physiological jaundice, are caused by an increase in the indirect bilirubin level. Excess breakdown of red blood cells leads to increased indirect bilirubin. Direct bilirubin is a water-soluble form. It is aggravated in a disease where the flow of liver is obstructed, and due to this, liver cannot excrete bilirubin in the intestines. How to know if a child has jaundice? Jaundice in the child can be identified by the yellow color of the eyes and skin. Jaundice is particularly difficult to notice in children with dark skin. In the case of jaundice, the white part of the eye will turn yellow. This is the only sign of jaundice seen in the initial case. As the level of bilirubin pigments in the blood increases, jaundice may appear on the forehead and face before spreading. As the severity increases, the jaundice progressively spreads to the chest, abdomen, thighs, legs, and last palms and soles. Yellow palms and soles are a sign of severe jaundice, and this condition requires immediate examination by the pediatrician. We can see the yellowing of the skin by gently pressing it on the child's forehead or nose with fingers. The skin will look yellow as soon as you lift your finger. When to consult a pediatrician? Consult your pediatrician immediately if your baby has any of the following symptoms along with jaundice. 1. Jaundice is visible in the first 6 hours after birth. 2. The child is not feeding well. 3. If the child is lethargic and sleepy. 4. If the skin of thighs and legs appears yellow. 5. If the child is irritable. 6. If the child's stool's white. In which conditions jaundice can cause complications in the newborn. The liver of a newborn baby has limited ability to handle bilirubin pigments. If the bilirubin pigment level rises too fast, it can cause complications. If it exceeds a certain level, it can cause permanent damage to the child's brain. The conditions in which jaundice rises very fast are as follows. 1. Disease in which excessive breakdown of red blood cells causes rapid increase in bilirubin level. For example, sickle cell disease, hemolytic anemia, G6PD enzyme deficiency. 2. An excessive amount of red blood cells in the infant is called polycythemia. When these red blood cells break down in their natural order, the bilirubin level can increase rapidly. If the mother has diabetes or high blood pressure, newborn baby can have polycythemia. Infants born with low weight may also have excessive amounts of red blood cells. 3. If the mother's blood group is of O type and the child's blood group is of A or B type, then red blood cells can rapidly break down and increase bilirubin levels. 4. If the mother has a blood group Rh negative and the child's blood group is Rh positive, then the baby may have excessive jaundice. 5. The liver of a premature baby is not able to handle bilirubin pigments effectively. The brain of preterm children is susceptible to brain damage by bilirubin. Therefore, prematurely born baby requires treatment at lower bilirubin levels. 6. If the child is not getting enough milk, the level of bilirubin rises rapidly. Inadequate milk also increases bilirubin levels due to dehydration. 7. Some rare genetic disorders can increase bilirubin levels very rapidly. 8. The obstruction of bile flow from the liver due to any congenital diseases increases the direct type of bilirubin pigment level. How is jaundice diagnosed? Pediatricians can diagnose jaundice after examining the child. In suspected cases, the child's bilirubin level can be checked with the help of a device called a transcutaneous bilirubinometer. When this device is placed on the child's forehead, the bilirubin levels are immediately displayed. The level of bilirubin at which treatment is initiated depends on the age of the infant, the duration of pregnancy, and the associated risk of rapid increase in bilirubin levels. If the bilirubin level is high, we need to send a blood sample to the laboratory for confirmation. How is jaundice treated? Treatment of jaundice depends on its level. Various charts are available to treat jaundice. Depending on the age, maturity of the child and the risk of its rapid progression, its treatment is decided. Your pediatrician can help you find out if your baby's jaundice needs treatment. If the level of bilirubin is below the level shown in the chart, treatment is not required. If bilirubin levels are high, the child needs phototherapy. During phototherapy, the child is kept under blue light, covering his eyes and genitals. This blue light reduces the bilirubin pigments present under the skin. Gradually, the bilirubin level in the blood comes down from a few hours to a few days. If the bilirubin level is too high or the child is more ill, your pediatrician may recommend exchange transfusion. In this process, the blood of the child is replaced by the blood of the donor. This procedure requires a qualified pediatrician and a well-equipped hospital setup. This is a medical emergency. Untreated infants may have mental retardation, deafness, blindness, or permanent disability. Certain conditions may require some specific drugs such as immunoglobulin. In some cases, detailed investigation is also required. In addition, related complexities such as dehydration must be treated. The type of direct bilirubin requires different treatment and approaches. Consult your pediatrician for detail. Thank you.